Is strep throat easily contagious among children? Imagine a tiny bacteria causing a sore throat that spreads quickly among kids. That's what happens with strep throat, a common bacterial infection in children. It is known to be highly contagious, meaning it can spread easily from one child to another. Understanding how it spreads helps parents and caregivers protect children and stop the infection from spreading further. Strep throat is caused by a bacteria called group A Streptococcus. It mainly spreads through respiratory droplets when an infected child talks, coughs, or sneezes. These droplets float in the air and can be inhaled by others nearby. They can also land on surfaces like toys, desks, or doorknobs. When children touch these contaminated surfaces and then touch their mouth, nose, or eyes, they can become infected. Sharing items like utensils, cups, or toothbrushes can also transfer the bacteria, making it easier for the infection to spread. Children are especially prone to carrying and spreading strep bacteria. Many kids, especially those between 5 and 15 years old, carry the bacteria in their throats without showing any symptoms. Studies show that up to 20% of school-aged children can be asymptomatic carriers. In households where a child has strep throat, about 25% of other children can also carry the bacteria without feeling sick. This high rate of colonization in children explains why strep throat spreads so rapidly in schools and daycare centers. The contagiousness of strep throat is highest during the first few days after infection. The incubation period, or the time from exposure to when symptoms appear, is usually 2 to 5 days. Even before a child shows symptoms like sore throat or fever, they can already spread the bacteria. If untreated, a child can remain as contagious for up to 2 weeks. However, once antibiotics are started, the contagious period drops significantly. Children usually stop being contagious within 12 to 24 hours after beginning antibiotics, which is why doctors often recommend starting treatment as soon as possible. Children who are in close contact with others are at higher risk of catching strep throat. This includes kids in crowded settings like schools, daycare centers, or playgroups. The more children interact closely, the easier it is for bacteria to spread. Parents and adults who spend time with children are also at risk of catching the infection from their kids. Some children carry the bacteria without any symptoms, known as asymptomatic carriers. While they may not feel sick, they can still pass the bacteria to others, which makes controlling the spread more challenging. If a child shows signs of strep throat, such as a sore throat that makes swallowing painful, a healthcare provider can do a quick test to confirm the infection. If it is confirmed, antibiotics are important to treat the infection and reduce contagiousness. It is crucial to complete the full course of antibiotics even if symptoms improve, to prevent the bacteria from coming back and to stop the spread to others. During this contagious period, children should stay home from school or daycare and avoid close contact with other children. Good hygiene practices like covering coughs and sneezes, washing hands often, and not sharing personal items help prevent transmission. Cleaning frequently touched surfaces is also helpful in reducing bacteria on objects children touch daily. Because strep throat spreads so easily among children, understanding its contagious nature is key to preventing outbreaks. Early diagnosis, proper treatment, and good hygiene are the best tools to keep children healthy and stop the bacteria from spreading in schools, homes, and communities. Always consult a healthcare professional for personalized advice and treatment options.